Hi, my name is Hoyt, and today I'm going to be presenting on schizophrenia and the impact it has on the general population and my life. So, what is schizophrenia? It's defined as a psychotic disorder characterized mainly by its gross distortions of reality, withdrawal from social interactions, disorganized and fragmented perception, thought, and emotion. Um, Down here, I have a table of the prevalence of schizophrenia in the general population. You can see it's compared to other comorbidities, or not comorbidities, just morbidities. They can be comorbidities, though. Um, so, if you don't know what prevalence is a percentage of the population that is affected with a particular disease at a given time. As you can see, schizophrenia is roughly 5 times more prevalent than MS, um, and 60 times more prevalent than muscular dystrophy, which is crazy. Um, Many people say the outlook for someone with untreated schizophrenia is worse than that of metastatic cancer. And the sad thing is because most of these most of these schizophrenics don't get treatment. They have a lack of self care and don't really know where to go from there. And most of them end up homeless or just an inability to get a job or socialize. And because of this, most of them end up in jail because people say they're just crazy. Um, the prevalence worldwide is only 1.1% uh, of the population over 18, but that equates to 51 million people worldwide. According to the WHO, someone with schizophrenia is 2 to 3 times more likely to die than the general population. Next, we're going to look at some signs and symptoms. So, three of the key symptoms of schizophrenia. There's three main symptoms: cognitive symptoms, positive or psychotic symptoms, and negative symptoms. Um, these are distinguishing symptoms for schizophrenia. Uh, Cognitive refers to attention and concentration and memory deficits in general. It's actually very similar to ADHD in its presentation. Um, you won't They have poor executive function or trouble processing information quickly. They have poor short-term memory or working memory. And working memory refers to the ability to retain and apply information quickly. So, for example, you're getting orientation to like a new job or something. They would have a lot of trouble on that first day. So the positive symptoms or psychotic symptoms, these include alteration of the five senses being taste, touch, smell, vision, and hearing. Um, so they will see, hear, touch, or smell things that aren't there, but it's real to them. So this is a loss in a shared sense of reality. They have hallucinations, and remember, hallucinations are actual sensory experiences that appear real, but they're only created in their mind. And they also have grandiose delusions, and delusions are fixed false beliefs that they think are real despite rational evidence. Um, you also have neologisms and clang associations. A neologism is a word or phrase of the patient's own making. So an example would be a made-up word that they just keep repeating over and over again, but it's not an actual word. And a clang association is actually a grouping of rhythmic words without reason. So they might rhyme things that make no sense to rhyme just to rhyme. Yeah, so our last symptom, negative symptoms. These are kind of a lack of emotion. Think think of someone with no expression who has brain fog. They have a lack of interest or enthusiasm. Their facial affect is just flat. They have speech difficulties and abnormalities. Um, they also have anhedonia or anhedonia, the inability to feel pleasure, which is very different from the grand nature of the positive symptoms of schizophrenia. So next I had a video planned of what it's like to hear auditory hallucinations. It's actually made by schizophrenics, so it's got a good bit of credibility. It's not working, so I'll link it in the bottom of the video so you can see it if you're curious about that. Next, we're going to go over some lifestyle considerations, or pertinent considerations at least. So since so many of these symptoms of schizophrenia can overlap with other mental illnesses, the diagnosis can take some time. So it's crucial to keep track of when the symptoms happen in relation to the patient. So because the symptoms, like the criteria for a diagnosis, takes some time. So you need to document exactly when something happened so you know for later. Yeah. So according to the DSM-5, if a person has 2 or more core symptoms lasting for a full month, and one of them includes hallucinations or delusions or disorganized speech, then the diagnosis can be made. So it's going to take some time. There can be a genetic factor, but it's only an increased risk factor because there's no one single gene linked to the disorder, like there is in Huntington's, for example. So at this time, it's not possible to use genetic information to predict the diagnosis of schizophrenia. According to the National Institute of Mental Health, research has shown that teenagers and young adults who use synthetic cannabis regularly are more likely to develop schizophrenia in later adulthood. Down here, I have the term anosognosia. Anosognosia refers to someone who is unaware of their own mental health condition or they can't perceive the condition accurately. Unfortunately, this is why, like I said earlier, so many schizophrenics end up in the incarcerated and homeless population because they can't seek help on their own or don't think they need it. Okay, so we're going to go over some medications here. This class of medications is called antipsychotics, and I've broken them down into typical and atypical. The takeaway is that typical antipsychotics inhibit D2 receptors and have higher extrapyramidal side effects. They're only effective in treating the positive symptoms of schizophrenia, whereas the atypical psychotics act on more receptors and have fewer extrapyramidal side effects. Also, there's 3 generations of antipsychotics, first, second, and third, so it would make sense that the newer ones have fewer side effects. So yes, the atypical ones are effective in treating both positive and negative symptoms of schizophrenia. When I say extrapyramidal side effects, if you don't know, an example would be like muscle contractility or restlessness, agitation, neurological effects with lower rates. So for an example would be Parkinson's or tardive dyskinesia. These manifest as shaking, like rhythmic movements with your fingers. It's a whole thing. Besides typical antipsychotics, there are 2 other classes, neuroleptics and dopamine agonists. Add that to the first, second, and third generation antipsychotics, and you can see there's a lot of different options here. And the trouble gets to be because not everything is going to work for everybody. Each medication works in a separate way, and so this is where genetic testing can be extremely helpful. in finding the right medication for you. GeneSight focuses on how a person's genes affect their response to the medication. So it's fabulous unless you want to go through and try each medication one at a time and you won't even see the therapeutic effects for like 3 months. And so that takes a lot of time to do that. So I definitely recommend the GeneSight. So now we're going to talk about the management of psychosis and delusions. You want to make sure you're maintaining the distance, make sure they don't feel trapped, because you never know what they're seeing or what they believe they're seeing or what pre-inclinations they have about you. You want to minimize stimulation, use of short, concrete questions when they seem confused. De-escalation tactics are a necessity here. That includes reality orientation with brief, simple instructions. Make sure to never outright deny whatever it is they say, because it's real to them. You want to affirm it, but never outright deny it. You want to allow them to vent, acknowledge their false beliefs without denying them. Be aware that you might be a part of the delusion. Like I said, you never know what part you play in their delusion. Above all, you have to remain calm, and in all likelihood, they're more scared of you than you are of them. It's the nature of the disease. So some short tips are to use a calm, even tone, minimize stimulation, give examples and explanations. Remember that they know what they are seeing to be real. Acknowledge it, but don't play into the delusion. Don't act as if it's real, but you want to acknowledge how they feel. So other treatment options, we have psychosocial, educational, modeling, reality testing, limit setting, milieu therapy, and ECT. With things like behavioral therapy, a person can learn what triggers their psychotic episodes, which is obviously invaluable if you want to prevent them in the future. That's where that educational part comes in. And some people are able to maintain that. They don't even have medications. They just know what triggers them, and they're able to maintain a sense of normalcy even without it. So it's amazing. Milieu therapy is everyday structured activities to slowly build their tolerance and regain skills. Electroconvulsive therapy is when small amounts of electricity are passed through the brain to stimulate. They also use this in depression, like severe depression. And it's usually 2 to 3 weeks, 2 to 3 treatments per week. And it's under general anesthesia. So no one fully understands why shock therapy seems to help, but they suspect that the ECD-induced seizures may affect the release of neurotransmitters in the brain. So yeah, I definitely want to thank you for listening to my presentation, and definitely go check out that video if you're curious about auditory hallucinations. It's the #1 manifestation in schizophrenics, and it's a neat experience. I'll link it below. Thank you very much. That's pretty much my presentation. Here's the sources. Thank you. Bye.